Hi, I'm Dr. Westphal. I'm a senior scientist at the Department of Dermatology in the University Clinic of Dresden. We're seeing a lot of patients with skin cancer in our clinic, but also patients with rare diseases. We had one patient with porocarcinoma, which is a rare skin cancer of the sweat glands. Unfortunately, there are no effective treatment options for this type of disease, so in order to propose treatment options, we included the patient in the master program of the National Center for Tumor Diseases, and they did whole exome sequencing and RNA sequencing. The data was then analyzed in Düsseldorf, and we found that there was a lot of genomic alterations in cancer-relevant pathways that are important for proliferation, migration, invasion. I want to note two here. This is the EGFR, the epidermal growth factor receptor pathway, and the MAPK pathway. In order to validate these, we took a cohort of 30 different porocarcinoma tissues that was kindly given to us, and we did immunohistochemistry on this to validate the pathways, and we could see that the pathways are also altered on protein level. We also had a cell line which we derived from our patient, and in this cell line we could show that the EGFR pathway and the MAPK pathway is strongly expressed. And using an anti-EGFR inhibitor or a MAPK pathway inhibitor, we could inhibit the proliferation and the induced apoptosis in the cell line. And finally, we actually had our patient, and the recommendations from the master program and our own data suggested that an anti-EGFR targeted therapy or immune checkpoint inhibitor therapy should work for the patient, and so he received both of those treatments, and they benefited him, and he survived for 2 years, which was very nice. So to summarize this, I think this is a very nice bench to bedside story where we had our patient, we investigated the mechanisms of this tumor progression, we proposed treatment strategies that benefited the patient, and hopefully it can benefit other patients with this porocarcinoma disease. Thank you.